It's that sense of being able to overcompensate for things when we're not feeling good. And that's not what we need to do. That's when we need to say, okay, look, I need a break. And there's nothing better for the sex drive and libido than a sexy vacation or some sexy time alone or some self-care and pampering. And, whether it's like allowing ourselves that curling up with a good book and a good cup of tea and talking with a good friend that makes us laugh, doing things that fill our tank so that we are better hormonally balanced and we can do the things that we want to do with joy.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. Many women are starting to look differently at menopause, realizing it can be a fabulous time in a woman's life. Women like Oprah Winfrey, who has been quoted as saying, "So many women I've talked to see menopause as an ending, but I've discovered this is a moment to reinvent yourself after years of focusing on the needs of everyone else." Today, we're diving into a different take on menopause with my guest, Dr. Anna Cabeca, who calls menopause our second spring. Dr. Anna is triple board certified and a fellow of gynecology and obstetrics, integrative medicine, anti-aging, and regenerative medicine. She has special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. When her own health took a challenging turn during menopause, she sought out the wisdom of healers around the world. She learned how to combine modern medicine with time-tested natural remedies and using delicious healing foods and simple lifestyle changes. Dr. Anna reclaimed her health and her life. She has a new book, Menopause, that she'll tell us more about. On today's podcast, Dr. Anna shares natural solutions for handling symptoms of menopause, like vaginal dryness, insomnia, mood swings, and low sex drive. She even shares how it's possible at 55 to have the vagina of a 25-year-old. This and much more on today's episode of the Woman's Doctor podcast. Dr. Cabeca, Anna, it's so great to have you on the podcast. How are you?
I am great. It's great to see you, my beautiful friend. Good to be here with you.
I know. And I'm so excited to have you on the podcast. I interviewed you for the Hormones, Health, and Harmony docu-series. And it's, we have such great synergy. We have so many things that we cross over in what we're trying to do to help women. And so I just love connecting with you. Thank you for everything that you're doing. So let's talk about menopause and some of the things that happen with menopause. But first of all, I want you to talk to people about why menopause should not be dreaded.
Oh, yeah, absolutely. We have to take a different perspective on menopause. And I like to say, breeze through menopause into the second spring of our lives, right? Where we have, we already know we're going to have less tolerance to things that no longer serve us. So hopefully we've been experiencing that already. Like, if it's not a hell yes, it's a hell no type situation. So, but being able to really enjoy ourselves fully without limits. And this is really a challenge because you can look around you and see very few people that are doing that, especially in today's day and time. But we can make this journey together and we can change the dialogue around menopause. And I always say menopause is natural and mandatory, but suffering is optional. And in my new book coming out called Menopause, I do a little bit of menopause around the world, right? And because I witnessed other women, doing amazing things in their lives and having energetic and having great intimacy and relationships. And, and this was really powerful to me to say, what, I really didn't see it so much in my patient population. A lot of things started to disconnect around menopause. And so the whole concept of increasing intimacy, increasing connection, especially at this time of life, is really powerful. And there, and I think that's what, having our voice, being able to express ourselves, being able to live our lives with passion. And though, in embodying that comes from a place of really good health. And it's, it's attainable no matter where our starting point is, to be honest.
Yeah, absolutely. And I think a lot of times we struggle through symptoms, we suffer through symptoms and think, oh, it's just part of being a woman, right? But I'm really hoping with this podcast and the docuseries to help reframe how we think about our health, and that when we have symptoms, they're a sign that something's out of balance, right? But let's talk about some of
Wait, I got to interrupt. Can we do like a mini spoiler?
Absolutely.
I want to do a mini spoiler because I remember with the docuseries, you're like, Anna, look, these are my labs. I'm like, God, you need a 2-week vacation because, oh, thank God I just came back from one. I'm like, because I could say, well, you need this hormone, that hormone, this other. You could just see, I'm like, okay, wait, we need a complete reset here. and it really does make a difference. I think many women will find, and like you too, Trevor, it's like we're so highly capable of powering through that it takes a lot to get us to that bottom out point. When we're bottom out, we have to be really bottomed out. Taken out by the knees in order for us to recognize, look, my tank is empty. So we never want to get to that point. And I always say we can only give from an overflowing cup. We can't give when we're empty. And so recognizing that when we're doing, we have book launches going on, there's interviews. I've been sitting down for 8 hours today, but I did 5:30 a.m. yoga class. There's got to be a balance, but my, bio strap says I've only done like 300 the steps today. I'm like, okay, I got a lot to do before I go to bed. But, it's that sense of being able to overcompensate for things when we're not feeling good. And that's not what we need to do. That's when we need to say, okay, look, I need a break. And there's nothing better for the sex drive and libido than a sexy vacation or some sexy time alone or some self-care and pampering. And, whether it's like, allowing ourselves that curling up with a good book and a good cup of tea and, and being able or talking with a good friend that makes us laugh, doing things that fill our tank so that we are better hormonally balanced and we can do the things that we want to do with joy. I've been a little disappointed lately, to be honest, as I've been listening, and I'm on more social media. I used to only be on social media to check on my daughters. Now I'm on it because I've got my book launch and I'm listening to what other people are saying. And I've heard a couple of GYNs just say like, there's, bioidentical, that doesn't make a difference. And I'm like, oh my gosh, okay. It hurts my heart for your patients because it does make a difference. And the second thing I heard someone say is like, yeah, it's just natural to dry up as you get older. I'm like, that's just natural. I'm like, that's natural, but that is not living. That is not living, and nor is it necessary, nor do we need to stay with that because we are filling up our nursing homes with women that have incontinence. And that's the straw that breaks the camel's back on the caregivers putting their loved one into a nursing home. Look, I want to be really high functioning for every day that God gives me. And so I think that, and I hear these from very smart women, influential women, GYNs, and I'm really disappointed with my profession right now. How are we still saying this? How is that still the message? Because then we're without help. And that's why I think it's important what you're doing, especially with the docuseries that you did, to give women this information so they can feel empowered. And that's what's so valuable because you're, likely not going to get it in that 7-minute GYN visit. Sadly.
Yeah. Yeah, it is unfortunate, but we are trying to do our best to get a different message out there, right? Yes. So with symptoms, they can start as early as in a woman's 30s, 40s, right? It's not that menopause is this like magical 1-year age thing that happens, right? So what are some of the symptoms that you start to see in your patients? And I know vaginal dryness is a big one.
Yeah, vaginal dryness is really a big one. And what happens is like early signs that we have hormone imbalance can start easily when we start our menstrual cycles, right? And definitely we see this period, and I call it neuroendocrine vulnerability between age 35 to 55, where we have the symptoms that bring a woman into the GYN, like, worsening PMS, menstrual cramps, irregular heavy bleeding, breakthrough bleeding, all of these things that bring you into GYNs, fibrocystic breast. But then coupled with that is the anxiety, the depression, the insomnia, the mood swings, the lack of desire, lack of libido. All of those things are coupled in. Those are neurologic symptoms, right? So it's the neurologic and hormonal neuroendocrine combination here that's related to this hormonal shift. But first, we're like, okay, and this is what I learned through my own experience going through a menopause when the second time at 48. But my hormones were dialed in. And this is why in my first book, The Hormone Fix, I write, it takes more than hormones to fix your hormones. It's absolutely true. And my hormones were dialed in. But this brain fog, the memory loss, the mood swings, all of that stuff was coming up. And what happens is that the brain's ability to use your progesterone drops, your estrogen drops, and your brain's ability to use glucose for fuel decreases. So your brain's actually starving. So we get these memory issues, the brain fog, memory loss. And the reason is gluconeogenesis in the brain, the brain's ability to use and create glucose for fuel, is hormone dependent. It says estrogen dependent, but I really think it's tied into progesterone, which is certainly a neuropeptide, just not studied that well. And so the use of ketones for fuel is not hormone dependent. So when we shift into a healthy state of ketosis, and I say the keto green way, we, get this better hormonal balance, all the symptoms clear up, brain fog, no more hot flashes. I mean, life is good. And so during this time, these hormonal changes are happening. So we have to optimize our nutrition and our lifestyle. That's always ground number one. That's foundational. More than what we eat, it's when we eat, who we're eating with, lifestyle factors are in there too. That's all very, very powerful. And then the changes that are occurring because of these hormonal changes, well, right, we're not going to, ideally, I don't want to have a baby at 55. So thank goodness, and I'm off the hook on that one finally, right? But, the vaginal dryness as a result of those loss of reproductive hormones can create discomfort and lack of orgasm and decreased pleasure as early as our mid to late 30s, and that is, as a result of the hormonal changes. And certainly, I have to say, a lot of the hormone disruptors and chemicals that are in our soaps and personal care products, and that's why I love your personal care products, or your skincare line is amazing because you get rid of all these gross things, right? Parabens and all that other stuff. And remind me to tell you about I'll tell you. But one of the things that many doctors recommend is an estrogen vaginal cream, right? So I looked up what an estrase is an estradiol, which is a bioidentical estrogen. So I'm like, okay, that's good. But what else is in that cream? So I looked it up today finally, and it's sodium lauryl sulfate, parabens. I mean, just like the list goes on with chemicals. I don't even know. I have to look up each one. But I was like, oh my God, that is toxic. And the vagina is so amazing because it's so vascular. And so it absorbs what you put in there, right? It's really well designed that way. So we want to, we definitely can reverse that by using bioidentical hormones and pro-hormones. I use DHEA a lot, and that's in one of my creams I created. So, Boulevard Cosmetic, you got this part, I got this part. We good.
We got this, Anna.
We got this. And I say, the most important real estate of your body, clitoris to anus, we got to keep that healthy because it does determine our quality of life, for the rest of our life. We don't want prolapse. We don't want incontinence. We don't want hemorrhoids. Those are miserable. So, any ailment is, but this is my specialty. So I'm biased.
Absolutely. Well, it's amazing. You've got it covered there. And, I usually recommend a compounding pharmacy so that people can avoid those already pre-made, but your products are very clean. So that's very helpful, certainly for us doctors recommending products. So thank you.
You are welcome. You're welcome. It was important to me, especially when I closed my medical practice in Georgia, to have something for my patients that was natural and without chemicals and hormone disruptors in them. And that didn't cause more harm than good, because a lot of lubricants too create more dryness, more irritation, more friction. And we want to avoid them. We want our bodies to create our own natural moisturizer. So as a single woman in my 50s dating, this is something important to answer. One of the things that we look at is longevity, right? And so I've just came back from a longevity conference, Da Vinci 50. And so you always hear definitely a very male perspective in longevity, and sexual health is really big from those aspects, but the women aren't addressed. And I said, and we talk about our biologic age versus our chronologic age. And so I said, I was thinking to myself, I should be able to say like, hey, I'm Anna, I'm 55, and I've got the vagina of a 25-year-old. How's that for healthy aging?
Oh my gosh, I love it. Okay. Well, you got to create some sort of device that measures that. So stay tuned.
I have a quiz. Yeah. How old is your vajayjay quiz?
Oh, great. All right. Well, where do people find that?
Well, it'll be available on my website at dranna.com. It's right now the Eve quiz, but I'm working on it to just give you your age. Yeah. Your vaginal age.
Great. And so hormonal balance really does, a lot of it goes back to the foods we eat, right? And that's why you've got a new book coming out, Menopause. So tell us about that.
Yeah. So I would say there's magic in the pauses. And like we said at the very beginning, Trevor, you brought to the point that, we don't want people to dread this next half of our lives, right? And I definitely don't. And I want to say there is magic in the pause. When we pause for whatever reason, if there's, if we have a pause on a weekend, we have a pause in our schedule, we have, take the pauses. And that's really like redefining who we are, giving our body a chance to, to settle in. Right? To get juicy, get comfortable, get rejuvenated. And that's really critical. So I love this. I love Menopause, because here in Menopause, I actually have 5 menu plans that each pause something different. So one pauses inflammatory foods like nightshades, and so it's an autoimmune protocol. It really follows an autoimmune paleo type combined with my keto green. I call that keto green extreme. And the second plan is plant-based on pausing animal meats, because we want to create diversity in our diet, get rid of constipation, and help support the gut microbiome, adding that extra fiber in too. And then the third is a carnivore plan, because some people have trouble digesting, pretty much most things. And so looking to see what could be irritating their digestive tract. And then the fourth is a cleanse. You're already in high ketosis by the time you go through my carnivore plan, that going into a cleanse, which is really designed to help support and rejuvenate your gastrointestinal system. Because, as I know, beauty starts from the inside out, right? A healthy digestion for a glowing complexion. All of that becomes really critical. And then the fifth plan is a carb up plan, because sometimes we've been so restrictive for so long and so low carb for so long, we actually need some more carbs to get a better night's sleep. So I play with each of these pauses, and you certainly can do one of them. You can do all of them. We'll be doing it in my Keto Green community on Facebook together as soon as the book comes out. It's available for pre-order now with some great juicy bonuses too. So a lot of good stuff. And then, just creating healthy community to do it together, because it's a lot more fun when we have fun people to do it with. So
yes, absolutely. Community is key, especially for us women. And it helps it's part of what helps harmonize our hormones, is having like-minded people and people to help support us, and sometimes even people to push us outside our comfort zone a little bit, right? Mm-hmm. Yeah. Well, Anna, thank you so much for all your information today. And for those of you who absolutely are loving Anna, like I do, we have more of her and the docuseries. So make sure you watch the upcoming docuseries and go check out Anna's book, Menopause. Thanks again, Anna.
Thank you for having me. Bye, everyone.
thank you for listening to the Woman's Doctor podcast. If you enjoyed the podcast, be sure to share it with the women in your life. And to learn all about balancing hormones, join us for the Hormones, Health, and Harmony docuseries at thewomansdoctor.com.